Welcome to Adapt and NCLEX, and thank you for deciding to watch this video. Let's practice some test-taking strategy for your nursing exams. If you're in nursing school, these are videos you want to watch. If you don't know, this is Adapt NCLEX. Check Adapt NCLEX on YouTube, and you will learn more. If you're preparing to take your NCLEX, you should also check Adapt NCLEX and subscribe. Quick questions that just to test your knowledge. This is the number one first question. Buzzwords all we're going to be using. Select all that apply, right? Which of the following the nurse should expect when caring for a client with SIDH? You see what I did from the back, and then I find my buzzword, SIDH. A nurse has attended a staff medication program about syndrome of inappropriate antidiuretic hormone. All I'm telling you, the nurse know about this. And therefore, if they're assessing the patient, what do you expect? SIDH, you have too much ADH. Therefore, you're going to hold on to your water. If you hold on to your water, you're not going to have any urine output enough. So most of your water will be held in your system. It's going to dilute things. That's the buzzword. That is the concept. Therefore, your urine output, you don't expect your urine output to be increased. Your serum osmolarity, because you're holding on to water, is going to dilute your serum. You don't expect it to increase. If your osmolarity is decreased, your sodium too has to follow the same pattern. Since you know you cannot void your urine, the little urine that you're going to void is going to be concentrated. Therefore, your urine specific gravity is supposed to increase, not decrease. If the specific gravity of the urine increases, urine sodium should also increase. Since you hold on to water, you're going to have weight gain. Therefore, the right answer is number 6. Test-taking strategy based on content. That NCLEX way. That's how you answer question. That's how you apply your content. And let's care for a client who is 24-hour post Roux-en-Y gastric bypass. Which finding is the most concerning? This is a prioritization question. If you want to know how to do that, check Adapt NCLEX. I call it be sharp. You have to be sharp selecting the answer. Which one of those you think is going to kill the patient? 1 day post-op, Roux-en-Y bypass, the content is here. What do you expect? There's 2 things these people will undergo through that you have to worry about. Pulmonary embolism and anastomosis leak. So infection, sepsis. So those are the 2 things you have to worry about immediately after post-op, right? But you have to be sharp in selecting. The urine output is low, 29, okay? It's very low. Big patient, 29. Heart rate is 105. Temperature is 99. And then the decreased breath sound. Don't be trapped, okay? Which of these do you look at it and say, hey, based on content, they just had surgery. You don't expect their lung to be great. At the base, look at the decreased breath sound at the lung basis. If I want you to know that they say the lung is infected or is collapsed, I will tell you not at the lung basis, but this is lung basis. This is like the individual, and you have atelectasis at the right after surgery. This is not the problem. Temperature is a little bit high. It's getting there, not too high, 99. Then you're left with this 2. A low urine output versus tachycardia. In patient who has a Roux-en-Y bypass, small tachycardia means pulmonary embolism or sepsis. So if you don't know about it today, just know. Anybody who has gastric bypass and he has tachycardia post-op, either they have pulmonary embolism or anastomosis leak. Test-taking strategy for your nursing exams, okay? In this case, for a client with anorexia nervosa, the nurse accidentally administered double dose of ondansetron to the client. The nurse immediately, she said immediately what? Inform the client, right? So immediately inform the client what happened. What ethical principle the nurse is demonstrating? Did something wrong and told the patient. That's all. Rewrite the question. I did something, I told the patient. It's not beneficent, right? It's not normophysine. All talks about do not do any harm or do good to the patient. One of both of them, right? They are all different. They're different, but you are not doing harm or you're not doing good for the patient. That's not it. It's between this and that. Are you truthful or are you honoring your words, right? If you're telling the truth and you're being honest with the patient, it's veracity. But if you basically promising and coming back and keeping your promise is fidelity. So this one, the nurse, tell the truth, no matter what, even though it's going to hurt, is veracity. So that's the answer. Next question. A novice nurse has attended the staff education program on fluid, right? Which fluid the novice should classify as hypertonic solution? Keyword hyper. Hyper means high. That means it's very high. It's greater than 0.9%. 0.9% is normal saline. Therefore, anything greater than normal saline is your right answer. I have lactate ringer. It's almost like normal saline, but I have what? 5% dextrose. So this is hypertonic. Same thing. I have 0.9 normal saline. I've added 5% dextrose, hypertonic. I have 5% dextrose in solution, right? When you have dextrose D5W sitting there on the table and is not in the patient, it's hypertonic, right? But when you infuse it, the liver digest the or break down the glucose and make it hypo. So a solution of D50, D5 dextrose is solution is hypertonic. 3% is more than 1%, therefore it's hypertonic. 5% is more than 1%, it's hypertonic. And 10% dextrose is also hypertonic. All of them are right answers. If you don't know, check out Adapting Plus for your nursing school and your English prep. You should check it. Next one, and this is assessing the client's reporting insomnia. Which finding the nurse conclude is associated with the client's insomnia? This is a good question just to test your mind, right? The keyword, buzzword, insomnia. What is going to cause the insomnia? Metformin does not cause insomnia. It's just a medication for your diabetes, right? Alcohol intake, yeah. It makes you sleepy, but it does not let you sleep deep. Therefore, it wakes you up multiple times. Diphenhydramine is used. You can use it to sleep, so it makes you sleepy, drowsy. So it's not doesn't cause insomnia. If you take naps during the day, several naps more than 30 minutes, yeah, you're not going to sleep. Trazodone is very sedative. It makes you sleep. We use this for treating insomnia. Therefore, it should not be causing the patient insomnia. Metazapine also do the same thing. These are antidepressants. I have good mental health pharmacology on my channel. You can check it out. But the two answers are 2 and 4. Those are the causes of what is creating the problem. Take care of yourself and thank you. If you like this video, you want this channel to grow, click the like button and come back next time. All the best of luck.